Okay, so just to repeat, we would like to record the audio of this interview and the video of this interview so that we can transcribe and store it. Do we have your permission to do that?
Yeah.
All right, thank you very much.
Yeah.
And so would you be willing to share your first name, your age, and what you do for a living?
So my name is Gina. I am 20 years old and I work as a pharmacy technician at CVS, and I also work at Dunkin' Donuts. So I have two jobs.
So are you on sort of the front lines in both of those then?
Yeah. A lot of my job, I come in direct contact with people. Actually, both jobs I come into direct contact with people. Um, so yeah, I'm pretty much on the front lines.
So that's got to be rough right now then.
It is, especially with this whole thing going on and knowing that a lot of people can be asymptomatic, and it's scary because it's like I don't know who I'm interacting with, if they've been sick, if they've been exposed, because nobody really tells you. Like sometimes at the end of transactions, like someone will be like, "Oh, I have COVID. You're gonna have to wipe everything down," and it's like some people aren't taking this very seriously, and it bothers me because it's a new disease that we haven't learned about yet, or we don't know much about yet, and people are just kind of going on about it like it's nothing.
Yeah, that sounds really just scary.
Yeah, no, it really is. um I have my mom has an autoimmune disease, and she also just got through cancer, and I'm petrified of just one day, like, someone I don't know has it and I don't know about it, and then I bring it home and she ends up getting it and ends up getting seriously hurt because of it. Like, I don't want to be the one to hurt my mom.
Yeah, I can't imagine how stressful that must be then.
It's stressful, like, it really is, but I mean, my bills don't stop and I can't stop.
And so you mentioned before that you're not getting hazard pay. So is that
Well, CVS claims that we're getting hazard pay at some point in May, but the thing is that I think the pay ranges between $100 and $500. Um, and Dunkin's, we're not getting any hazard pay. Um, and it's kind of frustrating because I mean, Dunkin's is one thing because we mostly get our money from tips, and that's something like I've kind of come to terms with. But with CVS, it's frustrating because it's like pharmacists and pharmacy technicians are always coming in direct contact with patients. The supply for medication is at a much more high demand now. Like, we're seeing common medications just get back ordered very easily, and um we see other pharmacies like Walgreens, Walmart, like everyone has gotten either a bonus or they've gotten an increase in their pay, and we're just kind of here like still not getting paid. Like, we basically have to wait to get paid. And I don't know. That's really frustrating to me because it's like everybody else around you is getting what they want, and then it's like you're kind of here just like, well, like then what's the point?
yeah? I'd imagine being really upset about that if I were in your shoes. And you seem a lot calmer than I'd expect you to be about this.
Yeah, I know. Because you know what it is, I've been going at this for a few months now. I've been a pharmacy tech for 2 years, and I've been working at Dunks for 3 months. So I've kind of just gotten into a routine, and I've kind of come to terms with, like, with certain businesses, no matter how much you yell and scream, like, they're not gonna listen. So it's like, I mean, I'm in a way grateful that I have a job right now because there's a lot of people out there that don't. There's a lot of people that can't find work. So it's like, I feel like if I complain about it, I'll almost seem ungrateful.
Yeah, and it's a really I can imagine it's a really hard place to be in.
A little bit, yeah. But I mean, again, like, I mean, bills don't stop coming. People are still going to need medications. People are still going to need food. And it's like your day really can't stop going. you kind of just have to keep working.
Yeah, how does that like make you feel, I guess? Yeah,
It's really taken a toll on my mental health in a way. It's hard for me to sleep at night because I literally worked from 4 a.m. to 11 a.m. at Dunkin' Donuts, and then from 2 p.m. to 8 p.m. I work at CVS. So it's like in the second I get home, and by the time I get to shower and I get to get my clothes ready for my second job, it's like time for me to work. And I've lost some people. I've lost relationships, and I mean, it sucks because I don't want to be working two jobs, and I don't want to be, stressing myself out. I don't work because I need to occupy myself, and I don't work because, I want to. I work because I have to. It's like if I don't work, then I fall behind, and it's not going to be good for me because my college loans are a lot, and I have a car payment, I have an insurance payment, um, I have a credit card bill, and I owe the money back to the government, but they postponed their stuff. But it's because I have to, it's a lot of money. I had to pick up a second job because at CVS, like I literally make enough money just to pay off two bills, and then I still have two bills that still need to be paid. So that's why I had to essentially pick up a second job, and it's depressing. I feel like I can't really catch a break sometimes.
yeah, I'm really sorry that you're in that situation. It really is. I can't imagine.
It's okay. I mean, I've gotten used to it. I've gotten into a routine, so it's not bad. Like it's not as bad as, it seems to be, but I just wish that sometimes I could catch a break. Like as much as I can't go out and do anything right now, I kind of just wish I had the free time just to be able to like do things that I want to do. And I feel like I had to grow up very quickly over the past few months, like ever since this whole thing started.
Yeah, and I can see that you're kind of upset thinking about this. Are you?
A little bit, yeah. It's just because people can be so cruel and ignorant when when they don't know a lot about something or when they're scared of something. But it's like, I wish people realize like we're all a team. We all don't know a lot about this disease. We all don't know, like one person may have it, one person may not. Um, like show symptoms and stuff. Like one person may show symptoms, one person may not. And I feel like they're just so in fear of everybody that they take it out on people. But I wish like people would realize that I'm human and I want to be treated like a human.
Yeah, I is it, I know that a lot of the time retail and workers, it's hard. Is it worse now than before? Or I guess you kind of said it was, but how does it feel, I guess, now?
Um, it's I because retail, it's a lot of like making sure like the customer's happy and stuff like that. And here and there, like I've always gotten the people that like have like flipped out over coupons, or they weren't happy that their med wasn't in stock. But now where it's like it's such in a high demand right now, like a lot, like simple medications are in high demand right now, and it's like then you call them and you tell them like, hey, like this isn't available right now, and you try to do everything you can to help them, and they're still not happy. And then it in a way just kind of makes you feel worthless, because it's like there's nothing you can do that like there's nothing you can do about something being on a back order. There's absolutely nothing you can do, but it's just like the fact that like that people can't sympathize with you and they try and understand, like, there's a lot going on right now and there's a lot happening and you're trying the best that you can. And it just seems like the customer issues have gotten worse. Um, More people are getting impatient now, our lines are getting really long. Um, People like deserve to be like, people think that they need to be served right away, but we're so understaffed. And then on top of that, no one's hiring because it's like, what's the point of hiring anybody if, this whole thing's going on? So it's a lot. And not even just on like the pharmacy side, but like even at Dunks, it's like you still see people that are like that should be home go out. And it's just like it's frustrating because it's like you almost like want to tell them like stay at home because there's like I see people come into like pajamas through the drive-thru and be like, oh, I just felt like getting a coffee this morning, but it's like you really should be staying home. Like I get it's frustrating being home and like staring at the same four walls every day, but it's like if it helps prevent another person from getting the virus, it's like I I would rather that. I would rather go insane than either get myself or someone else sick.
Yeah, it. I think a lot of people don't realize that. So
Mhm. Yeah. But yeah, I mean, because again, there's like not a lot about this virus that we know about, and it's I mean, my personal belief is that I felt like the second like a lot of cases started popping up in mass, we should have just put like anybody that's not an essential worker in mandatory quarantine. Like I have a friend that lives out in California. She um Lake County got, I think they shut the whole town down for like a month. Like everybody had to stay home. I think they're still in lockdown right now. But it's like I just feel like the governor is just so focused on trying not to make people, I don't know how to explain this. I feel like the governor is just trying so hard not to put like a twist in people's normal lives that I feel like he doesn't realize that the cases are just going to go up because people with the virus are going to go out not knowing they have it, or there's people with the virus that know they have it that still go out anyways, or there's people that should be quarantined that aren't staying at home. And it's like I understand that there's essentials that people need, but a lot of these people, like I see people every day at CVS just going up and down, roaming down the aisles, like it's just a regular day. But it's like we stay open so you can grab what you need and go. Like it's not a time to be roaming around. It's not a time to be, goofing around. It's like it's a serious time.
yeah. And so like do you feel like people aren't taking it seriously then? Like more like
I feel like, and maybe it's me, and this may sound a little mean, but I feel like only the people that are essential workers are taking it seriously because you know, as much as, CVS is frustrating to work at, I'll give it to CVS, they've actually implemented a lot of guidelines to keep us safe. Like we're required to wear a mask at all times when we're in contact with patients. We have to wear gloves. At Dunks, it's the same thing. We have to wear gloves and masks. Um, and you get the people that come in with a mask, you get the people that, don't come in with anything at all. Um, but I tried telling people as much as possible at CVS, like we offer delivery. Like if there's a way you can stay home, like just stay home because, you may be wearing a mask and you may be wearing gloves, but you don't know if you just touched something that someone with COVID had, or you don't even know if you have COVID. It's like, I may not even know if I have COVID. Like I haven't been anybody, around anybody with it, but I mean, you never know nowadays. Cause it's like someone could just have a fever, someone could just have a cough and they could have COVID. And to me, it would just seem like, oh, they might have a cold. So, yeah.
so even like with the masks and the gloves, do those like make you feel any better?
Um, it does, but it honestly frustrates me when I see people wearing painters masks and N95 masks because those aren't meant for them. N95s are meant for healthcare workers, not for me, not for me per se, because they're more used in in a room with someone with a really contagious disease. but it's like you have to be professionally fitted for them. It's not something you can just like, go willy-nilly, because it's supposed to be something where it's like 99% of the virus is, or whatever it is filtered out. There's like no way it can get through your mask. And if it's not fitted right, then it's there's no use of having it. So it's like I see lots and lots of patients with N95 masks, like more than like the regular surgical masks that go over your ears, a lot more. And it just makes me frustrated, because it's like I see all these posts on social media about doctors and nurses that need to wash and reuse their masks, and they shouldn't have to, and they shouldn't, because it has diseases and viruses on there. And it just makes me frustrated that people can be so selfish and take something that technically shouldn't even be theirs. I get that people are trying to stay safe, but I feel like a lot of people are uneducated about the use of masks and the type of masks and what they should be doing with their gloves. Like, people think that just because you have gloves means that you're immune to everything, and it's really to prevent cross-contamination. Like, with gloves, it's like my phone could have bacteria on it. So the second I touch my phone with my gloves, I have bacteria on it. Putting it, talking to somebody, it's on my face. Then I go and grab something, then it's on that. And I grab a door handle, it's on that. It's a lot of people think that they're just immune with gloves on, and that's really not the case. So, that's basically my thoughts on that. I think, some people are taking it seriously, some people aren't, but I feel like a lot of people are uneducated. And it's not something that, like, I'm not, trying to be mean to anybody, but I really think that people need to be educated on how to be sanitary, because in my opinion, I feel like even though we're wearing masks and gloves, I feel like people don't understand that it can still spread if they're not wearing gloves properly or washing their hands properly, because they think they're immune with these things on.
I can tell that's really frustrating, and it's really scary.
It definitely is. I because again, my biggest fear is bringing this home, because I live in a family of 5, and my biggest fear is that because my siblings aren't working, my mom is working, but her chances of being around a COVID patient are low, because she kind of works in more of an assisted living and dementia care facility. But it's like I'm always around people. There's no way of me avoiding that. And again, my biggest fear is just bringing it home, and I don't know about it, and then someone in my family gets sick, because it's like even with the stomach bug, it's like once one person in your family gets sick, everybody's sick, and I don't want to do that, because you never know, like with the virus, like how it could affect you. It could either be really good or it could be really bad.
Yeah, in your situation especially, I can't imagine.
Yeah, it's it's a little aggravating. I mean, there's nothing I can do about it. I can't go around and tell everybody how to wear their gloves and how to wear their masks. We can post all the videos we want, and we can post, all the things we want. But at the end of the day, people are just going to do what they want to do. And, I feel, as long as, and as selfish as it sounds, I have to protect myself. At the end of the day, I have to protect my family, because this is something, like, this isn't a disease where it's not like H1N1 where we found a vaccine, and we tried to limit the number of cases as much as we can. Like this, like there's no vaccine for this, there's no cure for this. Like, there's drugs in the process, and they think that certain drugs may actually cure it, but it's nothing definite. So I just feel like we shouldn't just be, thinking like, oh, it's just a flu, or oh, it's just a cold. Like, no, it's like it's serious.
Yeah, I guess we're getting sort of long on time here, but is there anything that,
Yeah.
like, if someone were to look at this, 50 years from now, is there something you wish that they'd really know?
I'd probably, oh my God, that's a hard question. I'd probably want them to know that no one's safe. Just because you're young or just because you're athletic or, you may have these factors versus others, you're not safe. And I would want people to know that the importance of being sanitary, there's not a stupid reason to wash your hands. There's not a stupid reason to change your gloves after seeing patients. Um, and there's a reason for everything. And we try to implement, these guidelines and stuff to help prevent the spread of it. And I feel like we should be taking a disease seriously from the beginning. Like if it has a potential of this spreading like wildfire, I feel like we need to, as hard as some decisions may be, grab the situation by the horns and just, maybe we have to put life on hold, maybe we have to put a lot of things on hold, but if that's going to help make one less person die or or prevent one less person from being sick, I think we should do that. And I definitely think that education is huge because, a lot of people think that they're immune with just simple protective equipment, and that's not the case. You still have to be sanitary, you still have to wash your hands, you still have to change your gloves, you still have to change your mask. Like, you're not immune. And like we see in the media, like there's like these young people in other countries, and they're like, I'm a fitness person, and and I do this and that, and I didn't think I would get COVID, and I didn't think it'd be a big deal, but they're on ventilators now. And I think, like, to sum it up, it's just no one's safe, and to be educated, and most importantly, sanitary.
And Ashley, is there anything you want to add?
So one thought I was having that you said earlier on in the interview was talking about when you're working at CVS and how people just seem like they don't consider you guys. This is also going towards a Snapchat you posted over the weekend about it, saying how people were going through the drive-through and asking if you could go grab their groceries for them. Could you maybe tell me more about that so I can understand?
Yeah, so basically, like, a lot of people, it's not even just like with that one particular day, but it's been over like, it's been since like this has started, that people would, because what a lot of people don't realize about pharmacies is that we need to have like a certain ratio of technicians to pharmacists. Usually it'll be 3 technicians to 1 pharmacist, and usually one has, one works at the pickup, one works at the drive-through, and then one fills medications. So I have people calling me and telling me that they want me to go grab shampoo, they want me to go grab their makeup, they want me to go grab milk, and it's like, I tell them I can't, and I have been screamed at multiple times because they're like, oh, well, you can't just get it. Like, they're like, why can't you just get it? And they're like, I don't want to come inside because I don't want to get the virus. But it's like, how come I get to get the virus so you can get your stuff, but hold on one second. Danielle, hold on. Yeah. Yeah, sorry. Hold on. I'm sorry. But my thing is that, like, why should I have to get the virus? It almost just kind of seems like they're saying that my life is worth less because I'm already there and I should just be, getting what they want just so they can feel better. It's like, it's hard. I've had derogatory things said about me on the phone. I've had customers come up to the window, and when I wouldn't get, like, it'll be something stupid, like when I wouldn't go all the way to the front and grab them bread while I have a line of cars in the drive-through, I'd get, things yelled at me. And it's, my life shouldn't be worth less, and I shouldn't have to risk catching the virus just because you want to make your life simpler. You don't want to come out of your car and come inside. It's, regardless, we're all around each other. Realistically, no one's social distancing because it's like, you're constantly within 6 feet of someone all the time. And yeah, I mean, I don't know, I wish people would just realize that, they're not really there's like no way to really be safe from it. I mean, well, like not everyone's going to get exposed to it. Not everyone's going to get the virus, but you can't hide from it. Like if you're willing to come out of your house when you shouldn't be and come pick up your prescriptions, you should be able just to come inside a store. It's no different than getting out of your house, because the second you leave your house, you're increasing your chance of exposing yourself to the virus.
Yeah, I'm sorry that's happening to you. That must be really tough to deal with, and I just wish people would understand more that you're a person too.
I do too. I just, it's draining, I just wish people would treat me like a human, and I wish, people would just be more understanding, and I wish people would just listen, because a lot of people aren't listening. They're not staying home, and they're going out, doing God knows what. And I feel like if people were just to, lay low until sorry, I choked the wrong way. I wish people would realize, like, if they were to stay low until these things blow over, like it would be so much easier. But I feel like a lot of people have heard that this virus isn't a big deal. You barely get any symptoms, and I feel like people have heard so much of that, and that's what they think, that it's not going to be a big deal if they get it, and they just disregard everything, and little do they know they're putting more people at risk.
Yeah, that's really tough to deal with.
But yeah, so.
Okay, well, thank you for sharing that.
You're welcome.
That's pretty much the main thing that I just wanted to ask about.
Yeah.
Carl, did you think of anything else?
No, I just really wanted to thank you. I mean, especially with how busy you've said that you are taking this time. It's really, really helpful to us. So thank you so much.
Yeah. Sorry if I'm like all over the place. Like I've been all over the place.
No, we want your story. So
thanks. But yeah, thank you guys for having me. I mean, I think it's really important that like people get their stories out there and they get their feelings out there, because there's just so much going on, and it's good to talk about it. In a way, it kind of takes a weight off my shoulders a little bit, because I know like someone out there like hears me and someone out there is listening.
Yeah. And that's our whole plan, and so we'll make sure to keep you in the loop as as this progresses, and tell you when you can see sort of what your story's become a part of, and hopefully 100 years from now people will be thinking that they're so glad that you took this half hour to sit down with us. But thank you so much.
Yeah, thank you guys.
Yeah, thank you.
All right, thanks, Ashley.
Okay, I'll talk to you later.
All right.